Good afternoon. I'm Kelly O'Connor,
I'm Katrina Anderson.
And I'm Yadira Green.
and the role that we chose is the substance abuse nurse, and Yadira is going to get us started.
All right. So like we said, the role that we selected was substance abuse nurse. They specialize in pain management. These nurses play an important role in patients who are experiencing intoxication and also withdrawals. They help treat patients who are addicted to drugs, alcohol, and other substances. They spend a lot of their time educating their patients, which I think is one of the most important parts of their job. Educating their patients about other treatment options by helping them understand the causes of substance dependence. A patient who has an addiction can be affected both physically and mentally. The nurse should be knowledgeable in both general medicine as well as mental health. Moving on to the next slide, why substance abuse nurse? This is a very demanding job like all other nursing fields, but this job helps many people who are faced with an addiction. It requires a special type of nurse who is able to emphasize with the patient and see the patient's addiction as a disease rather than a failure. The career outlook for for substance abuse nurse. The good thing is that they have a lot of opportunities to work in different areas. Some of the areas that they can work in, both in inpatient and outpatient healthcare institutions, drug treatment centers, psychiatric facilities, methadone clinics, and also hospitals. They can also work in physicians' offices as well. There is a high demand for this field, and this is based upon the number of people who become addicted to drugs. On the downside, there's not a high demand for new grads, and this is because it's not an easy job. They do need experience, and the nurses who gravitate towards this field are actually nurses who work in other fields and have more experience in it. Moving on to Kelly.
So to become an addictions nurse, you're not required to have any specific amount of experience, but many of these nurses have worked for years in other related specialties such as psychiatric nursing. All nurses receive training regarding addictions during their ADN or BSN programs, but additional specialty training can be obtained if desired through continuing education courses or on-the-job training. One of the specialty trainings you can do is to become a certified addictions registered nurse. To become one, a nurse must complete a minimum of 2,000 hours or 1 year of addiction-related nursing experience, 30 hours of addictions nursing continuing education, and then the nurse must then pass an exam. The certification must be renewed every 4 years. Florida does not require any additional licensure for nurses to practice in an addiction treatment setting. Certification, if desired, can be obtained through the Addictions Nursing Certification Board, which is a national organization. The ANCB helps to elevate standards of practice and provides continuing education opportunities. Certifications are offered for both registered nurses and nurses at advanced practice levels, such as the CARN or the CARN AP. And Katrina's going to tell us.
So our next slide is about major responsibilities. Administering detox medications to prevent seizures while assessing patients for signs and symptoms of withdrawal is one major responsibility. Assessments are completed to ensure patient safety, also to ensure patient is not having any symptoms of suicide or homicidal ideations. Education is provided to patient's family, as well as the patient, to encourage family to become a strong support system, as well as educating patient and family on the disease. Nurses also provide support, physically and emotional support, by encouraging relaxation techniques such as deep breathing, relaxation techniques such as journaling, educating patients on the importance of developing coping skills is an also important responsibility to help teach the patient to prevent relapse. The next slide is standards of care. Standards of care are formed around the ASAM criteria, which is American Society of Addiction Medicine. There are 6 dimensions in this criteria. The first is intoxication and withdrawal potential, potential for relapse, emotional and cognitive, behavioral situations, biomedical conditions, readiness to learn, and then also recovery environment, so where the patient is going to live and who they're going to live with. Treatment planning is also very important. Nurses help provide treatment plans and include their family. They work with a team to provide referrals for the patient, to set up aftercare, including sober living environment, and then following up with the discharged patients to ensure that they haven't relapsed and how they can be provided support and assistance. The next slide is professional organization and website. We've discussed already the International Nurses Society on Addictions. This is a professional organization committed for nurses on prevention, intervention, and treatment of addiction medicine, and then also American Society of Addiction Medicine, which is the ASAM criteria. The next slide is nursing shortage. Substance abuse and mental health is an area where nurses with a passion for this field are needed. There is a high turnover rate due to redirecting behaviors, and then also a high relapse rate, which is also discouraging for some of the nurses in this field. So next we have
health promotion. A substance abuse nurse provides teaching and prevention efforts to stop abuse from taking place. In addition to prevention efforts, the nurse also tries to provide access to treatment for patients who have an addiction issues. Health promotion gears to gaining and regaining control of personal well-being and encouraging healthy practices through education and training programs. So moving on to Kelly.
And regarding the impact of substance abuse nursing on nursing profession relates to the quality of care. The treatment of addiction was very controversial only a generation or so ago. And the International Nurses Society on Addictions was founded in 1975. This organization emphasizes compassion and education in relation to these patients. Addictions nurses help to legitimize the practice of substance abuse treatment and provide focused and effective care for the patients in need. So in conclusion, a substance abuse nurse has a demanding job. No specialization of education is required, but experience is preferable, such as working on a psychiatric unit. Certification can be acquired if desired, such as a CARN or a CARAP, and it can be a rewarding career for the right person. One of the greatest benefits is being able to help many people who have nowhere else to turn. Thank you.